How do I qualify for Medicare Part A without paying taxes? Imagine a health safety net that helps cover your hospital stays and medical needs without costing you a monthly fee. That's what Medicare Part A offers. But how do you qualify for it without paying taxes? Let's find out. Most people get Medicare Part A free if they have worked and paid Medicare taxes for at least 10 years. That's about 40 work quarters. When you pay Medicare taxes through your paycheck, you earn credits toward this benefit. If you hit that 10-year mark, you usually don't pay a monthly premium for Part A. If you haven't worked enough or paid enough Medicare taxes, don't worry. You might still qualify without paying a premium if you meet other rules. For example, if you are age 65 or older and have enough work credits through your spouse's employment, you can qualify based on their work history. You need your spouse to have worked and paid Medicare taxes for at least 10 years. Another way is if you are under 65 but have been receiving Social Security disability insurance benefits for 24 months. This means you qualify for Medicare Part A without paying premiums, even if you haven't worked recently. If you have Lou Gehrig's disease, also known as amyotrophic lateral sclerosis, you get Medicare immediately without waiting. People with permanent kidney failure or end-stage renal disease may also qualify for free Medicare Part A if you or a family member have worked enough to earn Medicare-covered employment credits. You can get hospital insurance without paying monthly. Working in government jobs can also help. If you worked for federal, state, or local government and paid Medicare taxes, you might qualify for premium-free Part A based on that work. Lastly, if your spouse, divorced spouse, or deceased spouse worked enough and paid Medicare taxes, you could qualify for free Part A based on their work record. If none of these options apply, you can still buy Medicare Part A by paying a monthly premium. The cost depends on how many work credits you have. Usually, the premium is higher if you have fewer credits. You can enroll during specific times each year, but waiting too long might mean paying a late enrollment penalty. Knowing these rules helps you plan ahead so you can get hospital insurance without extra costs. If you or your spouse have enough work credits, you can qualify for free Medicare Part A when you turn 65. For others, paying premiums is the way to get coverage. Being aware of these options makes it easier to understand how Medicare helps protect your health and your wallet.